This is what happens when your vitamin D is low. Vitamin D is an essential fat-soluble vitamin and hormone precursor that plays a vital role in various physiological processes, including bone metabolism, immune function, cardiovascular health, and neurological regulation. When vitamin D levels are low, multiple biological pathways are disrupted, leading to a wide range of health issues. This video provides a detailed scientific explanation of why these symptoms occur and how to prevent or correct vitamin D deficiency. Vitamin D is essential for maintaining bone mineral density and muscle function. Its primary role in bone health is to facilitate calcium and phosphorus absorption in the intestines. The active form of vitamin D, 1,25-dihydroxyvitamin D, calcitriol, binds to vitamin D receptors, VDRs, in intestinal epithelial cells. This increases the expression of calbindin D, a calcium-binding protein that promotes calcium absorption into the bloodstream. When vitamin D is deficient, calcium absorption is impaired, leading to hypocalcemia, low blood calcium levels. In response, the parathyroid glands secrete parathyroid hormone, PTH, to maintain calcium homeostasis by pulling calcium from bones, leading to bone resorption and demineralization. As a result, this causes osteomalacia, weak, soft bones that are more prone to fractures and pain. Osteoporosis in elderly, decreased bone density, increasing fracture risk. Rickets in children, bone deformities, stunted growth, and muscle weakness due to inadequate bone mineralization. Muscle weakness and cramps. Vitamin D plays a role in muscle contraction by regulating calcium homeostasis in muscle cells. Deficiency can lead to muscle fatigue, cramps, and an increased risk of falls. Vitamin D is a key regulator of the innate and adaptive immune system. Vitamin D enhances the function of macrophages, monocytes, and dendritic cells, which are responsible for detecting and eliminating pathogens. It stimulates the production of antimicrobial peptides, AMPs, such as cathelicidins and beta-defensins, which directly kill bacteria and viruses. Vitamin D modulates T-cell and B-cell function, reducing excessive inflammation while enhancing pathogen clearance. Individuals with low vitamin D levels are more susceptible to upper respiratory tract infections, colds, flu, pneumonia. Chronic vitamin D deficiency is associated with an increased risk of tuberculosis and autoimmune diseases such as multiple sclerosis, rheumatoid arthritis, and type 1 diabetes. Persistent fatigue and low energy levels are common symptoms of vitamin D deficiency due to its role in cellular energy metabolism. Mitochondria, the energy-producing organelles of cells, contain vitamin D receptors. Vitamin D influences mitochondrial oxidative phosphorylation, the process by which ATP energy is produced. A deficiency leads to impaired ATP production, resulting in low energy levels and chronic fatigue syndrome-like symptoms. Vitamin D is essential for brain health and emotional well-being. Vitamin D regulates the production of dopamine and serotonin, two key neurotransmitters involved in mood stabilization. Deficiency is associated with increased pro-inflammatory cytokines, TNF-alpha, IL-6, which can contribute to neuroinflammation and depressive symptoms. Vitamin D plays a role in neurogenesis and synaptic plasticity in the hippocampus, a brain region involved in memory and mood regulation. It will cause increased risk of depression, anxiety, and mood swings. Seasonal affective disorder, a type of depression linked to seasonal changes and reduced sun exposure. And there is a possible link to cognitive decline and Alzheimer's disease in elderly individuals. Vitamin D plays a crucial role in maintaining cardiovascular health by regulating blood pressure, reducing inflammation, and improving vascular function. Vitamin D suppresses the renin-angiotensin-aldosterone system, which controls blood pressure. Deficiency results in increased renin activity, leading to vasoconstriction, hypertension, and a higher risk of stroke or heart attack. Vitamin D also has anti-inflammatory and antithrombotic effects, helping to prevent arterial plaque buildup. As a result, vitamin D deficiency can cause hypertension, high blood pressure, and increased risk of heart disease, atherosclerosis, and stroke. Vitamin D receptors, VVRs, are found in keratinocytes and hair follicle cells, where they play a role in hair follicle cycling and differentiation. Vitamin D regulates keratinocyte proliferation and wound healing in the scalp. Deficiency can disrupt the hair growth cycle, leading to premature shedding. Vitamin D is essential for tissue repair and inflammation control. It promotes collagen synthesis by fibroblasts, which is necessary for skin regeneration. Vitamin D enhances angiogenesis, the formation of new blood vessels, which is crucial for wound healing. Vitamin D deficiency will cause delayed wound healing and increased scarring. Higher susceptibility to wound infections due to impaired immune response. Chronic vitamin D deficiency contributes to systemic inflammation and increases the risk of multiple chronic diseases. Vitamin D regulates over 2,000 genes involved in inflammation, insulin sensitivity, and cell growth. A deficiency is linked to chronic low-grade inflammation, leading to increased risk of type 2 diabetes due to impaired insulin secretion and glucose metabolism, autoimmune diseases due to dysregulated T-cell function, certain cancers, colon, breast and prostate cancer due to lack of tumor suppression. Thank you for watching this video. I will tell you how to treat vitamin D and what is the correct dose of daily vitamin D in the next videos.